Thank you, Grace, for recording. And then I need to add the video. Oh, sorry about that. Okay. You know what? You can watch this video when you get, it's just a really cute video, but I think you all know most of with herd immunity. Yeah, I don't think you can you hear? No. Okay. Sorry about that. Okay. So the second question, your pop quiz question is, what is wastewater surveillance? So, oh, sorry about that. It's a process used to treat sewage and make it safe for drinking and water reuse. It's a system for monitoring water levels in reservoirs and storm drains to prevent flooding. C, it's a method that tracks disease trends by monitoring infectious pathogens shed by individuals into wastewater systems. And D, it's a technology that detects leaks or blockages in municipal plumbing systems.
I don't have internet. It's okay. I'm on my phone with the code.
Okay, so go ahead and put your answer in the chat.
Got it. Somehow.
And the answer is C. Good job. It's a method that tracks disease trends by monitoring infectious pathogens shed by individuals into a wastewater system. And thankfully today we will have a special guest speaker later on who will tell us about how we as child care directors can use wastewater surveillance to help our community. Okay. Just to introduce ourselves, hi, I'm Martha Hensa, and Sining is on the call as well. So she can give a wave there. And so if you're wondering when you write to the Health ECE at bouldercounty.gov inbox, you're writing to Sining and I, if you have any questions about health or outbreaks. As many of you probably know, Jane Wilkinson is retiring at the end of December. Hopefully we can keep her on with some hourly time in the new year, but we have hired a new inspector and her name is Grace Peterson. Grace is on the call too. She can give a quick wave. But Grace, as you can see here, is with her daughter who just turned 1 over the weekend. And she was born in Boulder. She has an undergraduate degree from here at CU Boulder. And then she traveled around the world and taught English in Chile, Budapest, Hong Kong, and Vancouver. And then in 2021, Boulder County Public Health hired her in environmental health. And then we brought her on board as one of our new child care health inspectors. And her interests are cooking, dogs, travel, sports, spending time with her husband and her 1-year-old daughter. She gave me the slide a few days ago, and it was 11-month-old daughter, so we had to change it because she just had a birthday this weekend. Okay, so today we're going to be covering some inspection tips, and I took photos of a lot of your ECEs and just ways that you're just being very creative. So I'm excited to share those with you. Sining will be giving a respiratory season update. We'll be talking about the vaccine of the quarter is mumps, part of the MMR vaccination. We'll have updates from our partners, and then we'll have that special presentation about wastewater surveillance and how it's a tool that can help predict illness. Okay, Sining will put in the chat that as respiratory season is coming and there's just a lot more illness during the winter months, we have created this illness report form. And this form, if you use it, it really helps Sining and I help more people quicker. And so this form, a lot of these things you'll just have on the top of your head. So number of children enrolled, number of classrooms, number of children, ill children, number of ill staff, and if any children are hospitalized. So please fill out this form if you notice a trend of illness, anything above baseline for your facility. Some resources here. We have the infectious disease manual. And sometimes directors wonder, is this disease, should I report it or should I not report it? And in the infectious disease manual, it tells you if the disease is reportable or not. And then I think most of you already have the How Sick is Too Sick. If you check out the How Sick is Too Sick online, it's been translated into, I think, over 20 languages. So that's a wonderful resource as well. Okay, we love to partner with you so you have successful health inspections. So I've been going around lately, and there's always a regulation that frustrates people because the regulation says if food items are used as art and science materials, they shall be labeled for the intended use. For example, not for consumption. And so the reason we want, and so this was at the Coal Creek. One of the directors there loved to make labels. And so she made this label, and I said it was so good, could I photograph it? But you can see here she has baking soda, which many of you use to make slime, but also baking soda. So people will mix baking soda and boric acid. And we want to make sure that if you're using this baking soda to make slime for this science project, that you didn't accidentally dip the teaspoon into the baking soda and the boric acid and got a little bit of boric acid in the baking soda. And then you were making muffins for a different project. So we just want to make sure that these are labeled that it's only used for arts and science. So I thought this was just a great example of a really good label. This was at the JCC, the Jewish Community Center. And Emily there said, thanks to the infant teachers, this is what they do with labeling their bottles of human milk or prepared infant formula. So the regs say that the bottle needs to be labeled with the infant's name. And so you can see what Emily and her teachers did here, label bottle first. And this is for it's on a desk outside the door to the infant room. And so parents can see this. And so she's kind of training their parents to do it properly. And so label the bottle first with the first and last name and the date received. And then, let's see, we can mute some people here. See, Ning, do you mind muting?
I can do it, Martha.
Okay, thanks. And so you want to label with the infant's name and then the date received. And you can see put today's date on the colored tape. And then their system is that they differentiate that breast milk uses a red label, formula uses a blue label, and cow's milk uses a yellow label. So you can see the reg says all human milk and infant formula shall be used for the intended child. Bottles of human milk shall be differentiated by colored labels or another method approved by the department. So I just really wanted to honor the Jewish Community Center and how they kind of trained their teachers so that they met this regulation and kept their infants safe. Another regulation is that basic first aid medical supplies shall be conveniently located and available to staff for emergency use and inaccessible to children. Many facilities wonder, how can I do all those things at once? Well, I was at the BVSD Eisenhower preschool, and they worked with their custodian and could actually bore this this holder into a brick wall to hold the heavy first aid supplies. So I really like that idea. And then I was at another school, I think this was a Coal Creek, and they used a sticker and they found one that's really, really strong. And so they could put that on their building outside as well. And it withstood the elements. So thank you all to creative ECE directors and teachers. A different topic is portable air filters. So I'm not sure, but you may be interested in learning more about how air quality learn more about air quality in your childcare facilities. And there's quite a few studies which have shown there's a decrease in respiratory illness when portable air cleaners are used in child care. So this is just more of a heads up. So look for future voluntary surveys. You don't have to do it, but if you're interested, regarding your opinion on the benefits and challenges of using portable air cleaners in childcare facilities. Which is a great segue to Sining will be talking about respiratory illness.
Perfect. Thanks, Martha. Yeah, I'll be going over what the respiratory season outlook looks like this year, some resources that might be helpful to you all, and then a little bit about outbreak reporting and vaccinations for this season. So you can go to the next slide, Martha. All right, so this was published by the CDC in August, but so we're a little behind at this point. We're like 3 months out. But it gave us a good idea of what the season might look like just based on data that they have. But the CDC did expect that this upcoming fall, so we're already in it, and the winter respiratory disease season will likely have a similar number of combined hospitalizations due to COVID, flu, and RSV compared to last season. So it shouldn't look too different from last season, but that there are some factors that could lead to higher rates of hospitalization. So what they are mostly concerned about is that there might be some overlapping peaks, so times when RSV, COVID, and flu might be peaking at the same time or have high levels at the same time, and this could cause stress to the healthcare system. There's a likelihood of multiple peaks throughout the season as well, so things can kind of go up and then come down and then go back up again, and those can definitely, if those peaks are in conjunction, again, stress the healthcare system, but maybe give us a little bit of a false false confidence that the season is coming to an end and then it might peak again. So it's just kind of something to keep an eye on coming up the pipeline for this winter season. What they're thinking is kind of contributing to those peaks might be something like a lower vaccine uptake due to vaccine hesitancy, which we have seen for many, many years, and even more so since the COVID pandemic. And then some confusion regarding the recommendations that have come out this year. I will spend a slide kind of going over what those recommendations are and some resources that might be helpful if there is some confusion on if you are eligible for a vaccine or not. I will say that even as someone who works in public health and tries to keep up on the news, it has been very confusing for me as well. So I can totally understand why some people may not think that they're eligible for some of these vaccines. Next slide, Martha. Oh, we went backwards. Yeah, there you go. I was going to take some time and go through each of these resources, but I think that we have a pretty packed agenda today. So I'll just kind of talk through what each one is and how it can help. That first resource there, so all these resources are to give you a better idea of what respiratory illnesses are circulating in our community. It kind of gives you like a point in time look at what it's looking like currently. So the first resource is the Bug Watch. So this is published by Children's Hospital. It has not only respiratory disease, but some enteric illness as well. But they publish their data related to how many visits they're seeing related to different pathogens, and then how many positive test results they're seeing as well. So that gives you a better idea of what's circulating specifically among your the age range of the children that you all serve. We also have our own respiratory illness monitoring dashboard at our Boulder County level. So I actually am the one that publishes these weekly. It goes up every Monday. But this gives you a better, so there's one dashboard that has to do with emergency room visits, and the other one has to do with hospitalizations. The emergency room visits give you a better idea of who is coming in, and then hospitalization gives you a good idea of how severe illness might be. Obviously, people can still get flu, COVID, RSV, but hospitalization is going to tell you how severe that illness is and how that's affecting our community. This is not broken down by age group, so it doesn't really give you an idea of what communities it's affecting, but for right now, it just gives us like aggregate numbers. CDPHE also has their own dashboard. I'm gonna just let you take some time to look at it. It's kind of the same data that we publish at the local level, with ER visits and hospitalizations. And then Grace is going to touch on this probably in her slides, but there's also a wastewater report that gives you an idea of what is circulating respiratory illness wise, and they also report on other illnesses as well. Next slide, Martha. Okay, so I know that respiratory season is definitely a huge load for EC directors. It's also luckily norovirus season as well, and we get hand, foot, mouth, and we know that you guys are all very busy during this time. So it is kind of hard to know when the trigger point might be for when you let us know what's going on in your facility. Typically, we just say that if you're seeing any clusters of illness, even if they don't have a diagnosis, if they're seeing, you know, you're seeing a lot of cough in one classroom, or you're seeing a lot of vomiting in another classroom, that might be that might be a time when you would report to us. Any increase in illness that is above baseline as well. So, maybe I know that with infants, they're always having some runny nose or a little bit of diarrhea. But if you're seeing anything that's above is normally um, what is normal for your facility, that's when we would want to know about it. And then across the board, I would say that anytime you're not sure whether to report or not, you should just let us know, and we can tell you, thanks for letting us know, but, we'll just keep monitoring at this time, or we might, jump into action and talk about mitigation measures. You can always report to us using the illness report form, which Martha had described earlier, and then you can email us as well at the Health ECE. Martha monitors that daily, I would say hourly, and I'm always here if Martha is not, to be backup. So Alyssa asks, what information do you use to establish baseline per site? And that is a great question, but that is really up to you. I mean, baseline is going to vary depending on classroom size, right? So it's a little vague purposefully because, in a classroom of three ill kids might be a lot, but in a classroom of 20, three ill kids might not be a lot, right? So I think that it's hard to really establish what baseline looks like as a specific algorithm or a specific definition, because it's going to look different for each facility, because every facility has different, age groups, different class sizes, and things like that. Alyssa, if you want to reach out to me, we can maybe, if you want to come up with a definition together, I'm happy to come up with something with you so that it looks maybe more concrete for your facility if you want to put something into writing or something like that. But we can chat about that, and that goes for any other facilities as well. Next slide. Okay, and this is our fall vaccine schedule. I'm not going to touch too much on the bottom 3 age groups. I'm going to specifically talk about infants and children just because they are the age groups that affect you all. But at this time, so we love your local epidemiologist. She is a great, she's a epidemiologist that writes blogs essentially, but she's really good at keeping up with current news. And she does things in a way that is easier to communicate to the general public, right? So it's very easy to read, very easy to understand. So she put together this nice infographic for us that I stole, and I am crediting to her. But that first line there tells you, so for infants and children, all children 6 months and older are eligible for the flu vaccine. For RSV, all infants less than 8 months old and children 8 to 19 months with risk factors. So risk factors are going to vary. In those situations, we would just have them talk to their doctors, see what that looks like. Obviously, we're not asking you all as ECE directors and staff to make that decision. And then for the COVID-19 vaccine, all children 6 to 23 months, and then children 2 to 17 years old. Obviously, you don't serve 17-year-olds, but that that age group is wider, I guess, than the group that you serve. But 2 to 17 years old with risk factors or if parents desire vaccination. So really with COVID, they're just saying that you should talk to a healthcare provider before you get it at this point. But I think that most pharmacies are providing it. Just if you just have to have a discussion with your pharmacist prior to getting COVID vaccine, according to the guidelines. So next slide, Martha. Thank you. And then this is a slide that gives you a better idea of how well they work, what vaccines are available, and when you should get them. So for most of these, for all three of these vaccines, they're recommending pretty much now, earlier than now, to get the vaccine. But of course, it is never too late. We still promote vaccine regardless of if it's past the time of when you should be receiving it or not. But typically like September, October is pretty ideal time for any seasonal respiratory vaccines. They're all pretty effective. Of course, no vaccine is 100% effective. But as Martha touched on earlier, the more people that get vaccines, the better our community is protected just because of the amount of people that are protecting ourselves and then in turn and protecting the people around us. So like I said, they're fairly effective, all safe and recommended for most age groups. I'm not going to talk too much about the types of vaccines that are available because I don't know that that's very pertinent to this conversation. But if you want to take a look at the article that came out with this infographic, or you can reach out to me, we can discuss more specifics about types of vaccines that are available. And I think that's my last slide, but I might have one more. Nope, that's it. Cool. Thanks, Martha.
Thank you so much, Sining. And just along those lines, we have wonderful resources for your children or even some staff members to become vaccinated at our Boulder County immunization clinics. And so always look at the eligibility first before you sign up for one of the clinics. It's for children 2 months to 18 years with Medicaid, uninsured or underinsured, or adults who are uninsured or underinsured. And so we have vaccine clinics in Longmont and in Boulder. But I talked to the nurse that distributes these vaccines, and he said, make sure you always look at the link and the website, or click on the link to get to the website, just to make sure that they had enough people, staff people, to provide vaccines during these, especially the walk-in clinics. So before you send any kids or friends or staff there, just make sure you click on the link here for Boulder County immunization clinics. Okay, we always like to highlight one vaccine of the month. Last month or quarter ago, it was measles, and this quarter it's mumps. And I love to show this graph that you can see vaccines do work. And so you can see here, reported cases decreased by more than 99% after both the mumps vaccination programs started in the US. So in 1967, children regularly received 2 doses of the MMR, so that's mumps, measles, and rubella vaccine, and cases decreased from about 150,000 in 1968 to 231 in 2003. And we as epidemiologists like to look at something called the basic reproductive number. And that just means if you had one sick person enter into a room where no one was vaccinated, how many people would that person make sick? And so measles is very contagious. So if one sick person entered this room where no one was vaccinated, 18 people would on average get measles. Our vaccine of the quarter is mumps, and so that's a little less contagious than measles, but still 10 people would get sick. And then people always ask me, where is COVID on this? And COVID is between Ebola and HIV. So if one person stepped into a room with no one vaccinated with the COVID-19 vaccine, about 3.2 or between 2 and 7 people would get COVID. So I think to me, this basic reproductive number just ties back into the herd immunity and how important it is that we vaccinate ourselves. And Sining, I think, was going to talk a little bit just about, since she keeps track of the mumps cases in Boulder County.
Yeah, thanks, Martha. So mumps is a reportable illness in the state of Colorado, which just means that anyone who tests positive for it, their information is passed over to us so that we can kind of track things, make sure that other people aren't getting sick and things like that. So that's basically my duties outside of doing any outbreak reporting and outbreak mitigations. So that being said, when those cases are reported to us, we're able to track the numbers that come in every year. So you can see this goes back to 2001. That's as far back as our data goes currently in our current system. But the blue line are the confirmed cases, which just means that they have a certain type of test that's confirmatory, and then the orange are probable, which means that they might have a different type of test that's less confirmatory, or they were identified through a case interview with someone. So we were like, they've been in contact with someone who has mumps and now has mumps-like symptoms. And so we might have identified them as a probable case. So you can see here that while cases are not incredibly high each year, we're getting 1 to 2 cases prior to 2015 a year. It has climbed up significantly in the last 10 or so years. So we're seeing maybe about 4 to 5 cases a year on average, probably. It's not, again, not incredibly high. We still have great vaccination rates in Boulder County, but we are starting to see it climb. So it's just something to keep an eye out for with vaccine hesitancy and mindset about vaccines changing, what that might look like in the future.
Okay, thank you, Sining. And here's just some posters that I found that have been used. I remember when I was a child, one of my friends was born deaf, or not, she wasn't born deaf, but she became deaf and she didn't have the mumps vaccine. So mumps can be dangerous. It's not just the big cheeks in the photos that you saw before, but it can cause deafness, an infection of the brain and spinal cord, as also swelling of the brain in some children. So don't let mumps spoil your fun. MMR vaccination is the best protection against mumps. Jumping to a different topic, if some of you have some professional development days coming up for your staff, these are 2 excellent resources for you to use. This one is everything you needed to know about sanitizing and disinfecting, and it's free. And if you take this class or your staff take this class, you get PDIS continuing education credit. And then for your cooks, there's the Colorado Food Handlers Card Training. I took it recently just to update my skills, and it was just excellent. It does cost $10.99, but I would highly recommend that you and your staff look into taking the one on sanitizing and disinfecting for free, and your cooks particularly to take the Colorado Food Handlers Card Training. Another resource that we have is there's free mental health therapy sessions. I think you that work with children all day probably often just even forget to take care of yourself and forget even to have a drink of water. So let's all pause a moment, have a drink of water. Probably many of you haven't had a drink of water for a couple hours. You get so busy taking care of your kiddos. But the Naropa Community Counseling is offering 10 free mental health therapy sessions for up to 20 Boulder County ECE Center staff. And you can sign up. And I think Grace will put the link in the chat here. And it was also in the meeting reminder email that Jane sent out last Friday. But the staff can come to your team meeting, again, thinking about professional development, if you're interested in that, and they can present a 30 to 60-minute session to take care of your mental health. So if you're interested, you can do the sign up here or also contact Bill Monroe, who is the Naropa Community Counselor Director. So that's just a wonderful resource for you and your staff. I'd also like to honor Amy Benson May. So she is the owner of Treehouse Learning. I don't know if you're on today, Amy, but you can give a wave to everyone. But she was just honored because she chose to apply for the Colorado Green Business Network. And it's a wonderful recognition. And she got it because in her childcare, she really makes, as you can see here, we made the connection to incorporate ecological literacy and environmental stewardship into all aspects of our program and curriculum. So we believe that children thrive when adults, community systems, and environments are thriving. And we don't truly care for our children if we also don't care for the planet and the environment we live on. So here's a picture of Amy right here. And then these are other pictures of other people who were also honored with the Colorado Green Business Network. And if you're interested, Amy said, please reach out to me at amy.may@treehouselearning.com if you're interested in applying for it as well. And I heard the Colorado Green Business Network give a presentation, and they provided these two frequently asked questions handouts for you. Okay, then we'll hear from two of our partners. So we have the Early Childhood Council of Boulder County. I'm not sure if Amy is on.
Yeah, I'm right here. Hi.
Oh, wonderful. Thank you, Amy. Hi.
Hi everyone. I don't have a lot of updates to share. I know many of you have asked about our next EQIT Expanding Quality in Infant Toddler Care course, and the next class is starting the very beginning of January, I believe January 6th. It will be on Tuesday evenings, again from 5:30 to 8:30 p.m. I'm working right now with PDIS to get that up for registration. So hopefully within the next week, you should see it on PDIS and be able to register for that class on PDIS. We'll also be sending that update in our PD newsletter, in our December PD newsletter, so you can see how to register and the exact dates on there too. And then just looking ahead, we are this year going to be offering another EQIT course in late spring, early summer. So if you have staff or if anyone missed the winter class, we will start another one probably the end of May, beginning of June. So stay tuned for that. Also just wanted to mention that we are revamping our directors training series a little bit for 2026. And we are going to be offering every other month trainings for directors, and also a time to connect and meet with one another to share ideas, questions, inspirations. And that will be starting in January, and we'll have information coming out soon with dates and topics of interest. Dates and topics for different presenters that might come as we get closer to the end of the year. So also look for that. That will probably be in our January PD newsletter. And we're hoping to continue on building the community of directors that has been ongoing. And I think Amy's here from Boulder Day. Those of you that are on that director email list, she sent some information about that and a Google Doc to share any topics that you're interested in, that we'll hope to bring into this training series. And I think that's about it for now. Thanks to everyone who came to the Parade of Classrooms last week. as well. It was a great event, and it was really wonderful to be able to recognize Jane Wilkinson, the recipient of our ECE Legacy Award. And we thank her for all that she's done for all of us. So thank you.
Yeah. Thank you so much, Amy. And now I think Serena is on, and she'll give an update about the Child Care Assistance Program.
Hey everyone, this is Serena. I am the CCAP Business Office Manager. Thank you so much for the invite, Martha. Happy to be here. We're just going to chat a little bit about some basic data on the UPK stacking process. As you know, our phase 1 started back in September, and it's a manual process for the counties, the CCAP counties, to get the data from the state in order to analyze and look at it and start stacking the funds. So we're working to try to stack the funds between UPK and the payments, and then the CCAP payments as well. This is definitely a challenge at times. We get the data from the state, and we are only looking at kids with 30 hours or more of their UPK so that we can adjust or change the authorization for CCAP. So we are in that process right now, and then the phase 2 will be next year, which will be a little bit more automated. If you want to change the slide. So we did recently get information back in September, and we just got another spreadsheet in the beginning of November, which we are going through this process. And children that are awarded 30 hours a week for the universal pre-K and also authorized with full-time CCAP, we look at those, we compare them, and we are contacting each client, looking at the provider schedule that you have submitted to the UPK program. We look at the provider schedule, we see, how do they match? What are we looking for? And then we contact the family as needed to potentially update the authorization for CCAP. To see if they still need the 30 hours of care for a particular time frame. This is just for the school year, and we'll adjust the authorization as needed. Now, one thing that you may not know as providers is that when we contact the families, they have 45 days to actually respond back to us. And if no response is received, then we don't make any amendments to the authorization. We leave them as is. So it's really a case-by-case process that we're connecting with the families individually. Yeah. That's okay. So one of the challenges we had was that there are some providers that had not provided a schedule, UPK schedule, to the state or the UPK program. And so we just used a default UPK schedule guided by the state, and they advised us to do that. And sometimes we, the challenge of getting clients to respond. Now, this is still really fresh and new. Honestly, we just started sending out communication to the clients at the end of September, and we're coming up on that 45-day deadline, but we did have some clients that actually did respond. So it depends. And then we also are supposed to be getting data from the state every month, and we're still comparing. Are there new kids? Are there kids that dropped off? And then we are looking ahead and contacting those clients, or if they're new as well. So you can change the slide. A little bit of data. This is really interesting. So when we first started with UPK about a year, 2 years ago, and we started to think about this process of stacking funds, we were thinking, oh, there's going to be so many kids. And actually, there have only been right now, out of our over 1,000 authorizations we have for CCAP, there's only been 39 total clients that we had to contact. And we're having a 72% response rate, which is actually really good. That's really great. And then of those response rate, about 56% of parent fees have been changed. Now, we want to talk to the client and advise them that this is actually a good thing for you. If we adjust your authorization, your hours go down, your parent fee will decrease as well. And so that's kind of an advantage that they would have in order to respond to us to update the authorization. So I just wanted to give a little bit of information on that. In September, yeah, we had 29 clients identified, 25 were contacted, 18 responded. And then 16 clients needed authorization changes, and we're updating those. And then those authorization changes would go to you as the provider, so you would know when they would be updated, and the information in terms of the parent fee also changing or adjusting. So our outreach for it says October, we received an October file in November, and so we've been reaching out, like I mentioned, over the past couple of weeks to the new clients. So any questions at all? And if you do, if something comes up, if you have a question, you can always email me, or Julie is the eligibility manager for CCAP if you have any questions or concerns as well. So
Thank
yeah.
you, Serena, so much for the update.
You're
I bet
welcome.
you're happy it's going from manual to automated. That sounds like a
Yeah,
lot of good.
definitely. We're excited to see what happens in the future for next school year. Yeah. Thank you, Martha.
Yeah, if
Thanks,
you want to put
everybody.
your email address in the chat, that would be great.
Sure thing.
Okay, now we have a special speaker. Grace, thank you so much for coming to us from CDPHE and telling us about wastewater surveillance and how childcare directors can use that.
Awesome. Thank you so much for having me. Hi, everyone. I'm Grace Jensen. I'm the wastewater surveillance epidemiologist on the wastewater team at CDPHE. Really excited to be here today. I'm just going to share a brief overview of our program and how wastewater surveillance data functions under the larger umbrella of public health and how you all can use it. Next slide, please. So what is wastewater surveillance? It's overall a method that can track disease trends by monitoring infectious pathogens that individuals shed into our wastewater systems. It's a really good way to find early signs of disease in a community without needing to test each person. And it can provide us with additional data that can inform us about our community health. And it can help healthcare providers, local public health agencies, and you guys kind of allocate resources based on illness. Next slide, please. So what are some benefits of wastewater surveillance? Again, it's a really non-invasive way to track illness in a community. It can help people understand the risk of disease in their communities. We're also able to find cases of illness in people that may be asymptomatic. That was very much the case with COVID, and it is now the case with some measles cases. And we can identify new strains of a virus sometimes before we see it in clinical samples. Next slide, please. We can also detect increasing trends of illness to help healthcare providers and public health provide resources. We also share our data to a national wastewater surveillance system. So not only can you look at the state level, you can get a national view of what's kind of going on with some of these diseases. And we don't rely on healthcare access or utilization. And it's really helpful for tracking diseases with limited pathogen-specific clinical testing. Next slide, please. So there are some limitations for wastewater surveillance. We're unable to identify exactly who is sick, and we're also not able to capture homes or businesses that are on septic systems. We also have a lot of population pattern movements that we can't necessarily always provide for, and different people shed the virus in different amounts. Next slide, please. Wastewater surveillance overall is just a complex and emerging science, and results may vary between the different utilities that we're monitoring. Environmental effects aren't always fully understood, and sometimes the fragmented genomes can lead to difficult interpretation of variants or viruses. Next slide, please. So here's just like a really basic overview of what happens with the samples. So the wastewater utility will collect the raw sewage sample from their influent flow before it gets treated. Our lab receives and processes the sample, they'll test the sample, and then they'll report the results to the data team, which is me, and we'll go ahead and analyze the data and post to our various dashboards. Next slide, please. So this is a really super high-level timeline of the evolution of our program throughout the years. Wastewater surveillance really started early in 2020, where utilities formed these more informal collaborations with private wastewater testing companies. But in August 2020, CDPHE began monitoring at a few sites around the state and in partnership with the University of Denver. And our state program really began to grow from there. So in 2022, Colorado was awarded as a National Wastewater Surveillance System Center of Excellence. And so we've been able to grow our team, our pathogen panel, and our community engagement initiatives because of those funds. In August 2024, we really began to look forward and realize that we needed to focus on much more sustainable practices to preserve the longevity of our program. So we began piloting the Sentinel surveillance site model, which I'll go over in just a second. Next slide, please. So I'll just go over kind of like the main structure of our program. Next slide, please. So overall, here's a visual of the locations of our wastewater testing sites in Colorado. The orange triangles are our Sentinel sites where we test routinely twice per week. And the yellow dots are our emergency surveillance sites. And I'll go over the difference in a second. But you can see that there's a concentration of sites really along the Front Range. And that's simply where the majority of population lives in Colorado. So that's really what we're covering. Next slide, please. So our routine Sentinel surveillance system model includes 21 utilities. The majority of these utilities were selected as they were serving the largest populations in their respective all hazard emergency management response regions. We also selected additional utilities in the Denver metro area to cover a lot more of that dense population. And we also selected a few utilities that have high tourism. So historically, we tested at more than 60 sites statewide as part of our routine surveillance. But of course, as COVID funding kind of dwindled and the scope of public health changed just a little bit, it was important to implement this model that was more sustainable long-term and allowed us to prioritize not just testing for COVID, but a whole panel of other illnesses. Next slide, please. But not wanting to lose the important partnerships we'd fostered with all of our utilities, we implemented something called our emergency surveillance site system. So all previously implemented participating utilities that were not part of the Sentinel model were invited to join the emergency system. So it's a short-term emergency system that can be activated when rapid public health response is needed. We can monitor a pathogen spread across communities, and it allows public health to respond more effectively to outbreaks because we can get that more granular level. Next slide, please. But here's all the current exciting targets that we test for in our program. So we, of course, are looking at measles, EVD68, which is an enterovirus, of course, COVID, West Nile virus, Mpox, influenza, RSV. We're also piloting Candida auris and antimicrobial resistance genes. Next slide, please. So how do we determine what targets we onboard for future surveillance? We have to ask ourselves a few questions, mainly, what data do hospitals and doctors already provide? How is public health tracking this disease already? What are the consequences of looking for this disease? What groups will use this data? What public health actions could be taken based on the data? And will community healthcare providers use this information? Will you guys use this information? So essentially, is the juice truly worth the squeeze on this? Next slide, please. Just going to overview kind of what our public dashboard looks like and how you guys can use it. Next slide, please. But our data is shared in a number of places. We have our public-facing dashboard on our state website that's updated twice weekly. We also have an internal dashboard that we update more frequently throughout the week, and this is for our internal LPHA partners and utility partners. We also share certain pathogen data to the CDC's National Wastewater Surveillance System dashboard, and that's updated weekly on the CDC website when the government is open. One thing that our program really prides itself on is our robust community engagement initiative. So we're regularly hosting town halls and information sessions, as well as attending various conferences. We really want to help educate and engage our community on wastewater surveillance, because after all, this is where they live, it's where they go to school, it's where they recreate. We want to make sure that we're being really responsible data stewards. But of course, if there's trends of particular public health concern, we make sure to work with the local public health agencies and anybody that would need that messaging. But next slide, please. So here's a look at our public dashboard. This is the newest version of our dashboard that was launched in March. It includes all of the current pathogens being monitored publicly, along with all of a summary of the detections and trends. We also link to the statewide and regional clinical data for the respiratory pathogens that was talked about earlier in this session. Next slide, please. But on the main section of the dashboard, after you've checked the pathogen you'd like to view, you can explore a summary of the trends at each utility that we monitor statewide, and you can also select the utility you'd like to view and get a closer look at the sewershed boundaries. So I selected Boulder for this one. And you can also get an explanation of the trend classification. But if you don't necessarily live in Boulder, we integrated this nifty little zip code search, so you can type in your residence and check out what utility is close to you. Next slide, please. We also have viral concentration graphs, so you can kind of change the date period you'd like to look at and see over time what the trends are doing with the wastewater data for each pathogen. Next slide, please. And we also have an overview of the trend categories that we use. This displays the detection categories for all of our pathogens except for COVID. We use kind of a more involved trend classification for COVID because we have the most historical data and a really high baseline of it in wastewater. You shed COVID like crazy. So that's kind of our approach for that. But every pathogen is different, so we can't use the same trend model across all of our pathogens, but we're still always trying to learn what trend methodologies will work best for all of our pathogens. Next slide, please. We also further subtype flu A, and so you can toggle that on and off on our viral concentration graphs. H1 and H3 subtypes are generally the major strains that cause our seasonal influenza. We also test for H5, and that causes avian influenza. But next slide, please. So to quickly sum it all up, here are some actual applications of wastewater surveillance data for folks. On this call, wastewater data is often used to message about vaccines. We've gotten feedback that the data can be used to indicate the start of respiratory season. It can also help us respond to emerging pathogens such as measles and seeing what areas are kind of popping up before we even hear about clinical cases. So it can give us signs and symptoms to look out for in our facilities or classrooms. And of course, knowing illness is circulating is a great reminder to continue to emphasize proper hand washing and hygiene techniques, and of course, encouraging staying home when sick. Next slide, please. But that's all I have. I have linked our team inbox on the slide, but I will also share a link to our public dashboard. And we also have an upcoming virtual community engagement meeting this week. So if you're interested in learning more about our program and you want an opportunity to ask more questions, I will link that in the chat. But thank you so much for having me.
Thank you so much, Grace. It's so fascinating to learn all these more modern tools to help predict illness in the community and to know how to prepare for it. So thank you so much for coming. So just as we close here, if any of you on the call would like to receive professional development certificate, please email us with your first and last name and facility name in the and send it to healthece@bouldercounty.gov, and we'll send you your professional development certificate that you can use for PDIS. And if you all have future ideas of what you'd be interested in for these quarterly meetings, please also email us at healthece@bouldercounty.gov. And our next Health ECE Partner Meeting, there's a little heart there in the picture. So what month do you think it might be? It is February. So February 9th, 2026, and it's the second Monday of the month from 12 to 1. So thank you so much for participating. And our common goal at Boulder County Public Health with all of you ECE directors and partners is just to prevent the spread of disease, to keep classrooms open, and provide healthy spaces for your children and your staff to learn and thrive. So thank you so much for attending. And if you have any questions, you can unmute yourself or put them in the chat or email us later. Thank you again. And Grace, you can probably stop the recording.